Well, medical marijuana is probably one of the most common questions that we get as well. We had a few questions in our educational meetings about what's true and what's hype and what's false about the whole story about medical marijuana. The facts from all the data and research that we know is that there's no really good evidence that it makes any difference for growth of cancer, for at least in the positive way. There's actually been a recent study that I haven't had a chance to read in whole detail, but I saw the abstract where they were it showed that it could potentially slightly adversely affect patients with cancer. The general problem with the trials that were done is because even researchers had limited access to THC or CBD to actually do proper, well organized and designed studies to answer the questions that we need. That's changing now with a lot of countries changing their regulations, and we will soon have better answers about what's true and what's not. What we know that it does help with is some of the symptoms related to cancer. And it can help with the appetite. It can help control the nausea that is refractory to all the standard nausea medications, and it sometimes can help with the pain. But again, managing symptoms is always subjective, and what I say to my patients that are using it, and if it's helping with the symptoms, I certainly wouldn't object them continuing to use it, especially if they've already tried some of the medication we prescribe and they're not working, and they find that it helps for nausea or for pain. Then by all means, I wouldn't stop anyone from using it. But yeah, at the moment, I don't think it has a role in slowing down the cancer or particularly not curing cancer. And that's one of the issues that I have with a lot of information and that's available on the internet. There's a lot of false claims and that's not substantiated by any proper data.